I have really serious pain and I don't know what to do about it. So going through the medical system was really, really challenging, and it took a lot of effort for me to advocate for myself and say, something's not right, I don't feel better, I need more care. That was what the most frustrating thing is, that I would say, I'm in pain, and doctors would say, well, here are drugs. And I'm saying, no, what do I do to get out of pain? Not just do you put a Band-Aid on the pain, how do I make the source of the pain go away? And that's what really, really made me angry. Because if you kind of let yourself go, oh yeah, well, I achieved that, and just shrug it off and go, no biggie, you're not giving yourself the credit of how hard you had to work and what you had to push through.
All right, Dana, so welcome to Becoming a Better You podcast. So we're celebrating today a lot of accomplishments and transformations. So we have a little bit of our bubbly.
Cheers.
Cheers. So there was a moment in your life when your life changed. Can you tell me about that while I sip my bubbly?
Certainly. So I had been a martial artist for as long as you have. We started actually around the same time. I'd been a martial artist since I was 8 years old. And I had come back to Rhode Island from living in New York. And I had joined a new dojo. And I was really excited about it. And I was in my first year of graduate school.
Now, how old were you?
I was 25. And
were you dressed like this?
Actually, I was.
I don't doubt it.
No, I was. I was wearing a black dress.
Universe.
Yep, I was wearing a black dress. And I had just finished my first year of graduate school, and my husband and I were going, well, boyfriend at the time, but husband now, we're going out to celebrate. And after we went to see a play, we were crossing the street downtown in Providence, and a car came around a corner. We were in the crosswalk, but a car came around the corner and hit us in the middle of the street.
So you got hit by a car?
Yeah, just boom.
And so I can't ask any other question but this. What does that feel like?
Horrible.
Yeah, I can imagine, right?
It's not fun. My husband got hit first, and he flew like 10 feet and landed on the ground. I got hit in my leg, and then that spun me around, and so I got hit in the back, and then I went up on the windshield, or up on the hood, and I smacked my head on the windshield and broke the windshield with the back of my head, and then slid off the car and landed on the ground. So it felt really bad, and it was strange and scary because we got blinded by the light.
Yeah, you didn't see it. Oh, you saw the light.
Yeah, it was nighttime, so we got blinded by the headlights, and I just remember screaming, oh my God, and then boom, 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 on the ground.
And how long were you laying there?
I didn't actually lay there for much time at all because I saw my husband laying on the ground. And so I scrambled over to him to check if he was okay, which was terrifying. Worst moment of my life, wondering if he was alive or not. And he was alive. He was fine. Well, not fine, but, he was there, breathing. And then all of a sudden there were, people surrounding us and saying, don't move, lay down. You could have all these injuries. You need to stay put, sit down, lay down. And luckily it was right outside the old Lupo's. And there were cops there kind of immediately. They came pretty quickly. But I was severely concussed. So I kept saying, I got to go to my car. And they were like, you're not going anywhere, sweetie.
So what were the injuries that you sustained from that accident?
So thank God, it's a miracle. I didn't break any bones. I don't know how that's possible. But the injuries I sustained were more like deep tissue damage because I got hit in the back of my calf. So that really messed up my, your fibular head.
Okay.
Yeah, it really screwed up like my knee and the back of my calf. That whole muscle had a ton of damage to it. And it was kind of something that was really hard to define as I went through physical therapy. And then my hips got, really jostled because I got hit in the back.
Did you go up in the air or did you just go down?
No, I went up on the hood of the car.
Okay.
So it hit me in the back, and then I went up on the hood of the car and then smacked the windshield with the back of my head. So I didn't like fly up in the air so much as I went over the car and then slid and fell on the ground.
So your experience going through the medical system with these injuries. And now, a lot of things, if you don't have any broken bones, sometimes, and I don't know the exact story for you, sometimes people can be like, after a while in the medical system, she's faking it or she's exaggerating. Can you tell me, like, just your experience through the medical system?
It was terrible because when I got hit, my hips had gotten so out of, knocked so out of whack. Plus I had, broken the windshield with my head. So I had a really bad concussion. I mean, I was saying the wrong words for weeks.
You had a brain injury.
Oh, serious brain injury. It took me 3 years to be able to remember a series of numbers or a code. And even now, still, once in a while, like especially if I'm really tired, words just don't come. So going through the medical system was really difficult because it was one of those things where I had soft tissue injuries and I had structural injuries, like I had gone to the chiropractor and gone through physical therapy. But then when I was still in pain, I was literally told by a pain specialist that it's all in your head. And I'm like, no, I have, really serious pain and I don't know what to do about it. So going through the medical system was really, really challenging. And it took a lot of effort for me to advocate for myself and say, something's not right. I don't feel better. I need more care.
And so when that moment happened, what did you do? Right? Because from my experience in the medical field, when doctors don't have answers, they'll refer, but after some time, they honestly would just be like, it's in your head, you're making it up. It could be like you're drug seeking, right? So what was your experience with that? How did you advocate for yourself when you got to that part of the medical field?
Well, it's interesting. I never saw any drugs. Even when we first got out of the hospital, they took a bunch of scans and everything. We were at the hospital for hours. And I took Advil, but that became an issue too, because then it really messed up my tummy. So in terms of, advocating for myself and all that, I would just have to kind of continue to go to different providers. Like if a provider wasn't giving me what I needed, I would just move on and say, you know what, you're really not hearing me. You're not listening to what I'm telling you.
Did you find that a lot of people didn't listen to you?
Oh yeah, it was really bad. It was really, really bad. Thank God. I had one really wonderful physical therapist when I first started. She was magical.
A lot of us are really good.
I know you are. I know that you are. She was really wonderful, but I know that she kind of hit a point where she said, there's nothing really structurally wrong with you anymore. I don't understand why you're still in pain. And I'm going, I don't know either, but I certainly am.
But I think so this is how I would treat it too. Like she admitted, I don't know what else to do with you, versus saying you're making it up or there's something wrong with you, right? Or whatever. And I think when you have that rapport with the client, and we were talking about this in another podcast, physical therapists spend a lot of time with patients, right? We could be with you for 3 hours a week. That's more than almost any other medical professional you're going to see.
Oh, yeah.
So we Dana, I don't know where to go from here. I feel like we just have that rapport where we can admit that, I don't know what to do, versus put you in or label you as bad or label you as drug seeking or label you as making it up, right? And I applaud her for doing that. So then what happens?
Well, one of the issues in terms of, this is so crazy, receiving totally inadequate medical care
Sure.
is that there was absolutely zero follow-up treatment for my brain injury. I saw one neurologist one time. He made sure I could say, tie, ball, dog, cat, and I wasn't completely fritzed. And then he was like, all right, you're fine. It'll just take time. I had zero therapy for getting my brain to work again.
What year was this?
This was in 2010.
Okay, so they knew about probably brain injuries and CTE. Yeah. I would assume, I think it was out then. So we're going to get to that in a second. So how did you keep advocating for yourself till you got answers? What did you have to do?
I mean, I think the most important thing was to just know when to walk away.
And find someone else.
Yeah, know when to walk away and say, I know myself better than what you're telling me. I should, it should be happening with my body. I know my body, and I know that this isn't right. So I'm going to go find someone else.
So one of the patients that I have, he's a priest, and he said...
I remember that guy.
I still have him.
He's still alive?
I'm a good therapist. But he was saying that his old doctor would be like, nobody knows the body better than the person who has it. Mm-hmm. Totally true. Right. So it is important for people if not getting the medical care they need, to be that advocate, seek out professionals, because somebody will help you. Mm-hmm. There'll be somebody who knows the diagnosis that no one else knows.
Yeah.
Right. There is somebody out there. You just can't give up. And I think the way a lot of the medical community is now, it's like get them in, get them out, throw them drugs. Or
that was what made me so angry, is that people just wanted to give me drugs. And I'm saying, I don't want drugs. I don't like drugs. I've never been that kid, even in high school, wasn't that kid like, oh yeah, let's try acid and all this crap. No, thank you. But yeah, I mean, that was what the most frustrating thing is, that I would say I'm in pain, and doctors would say, well, here are drugs. And I'm saying, no. What do I do to get out of pain? Not just do you put a Band-Aid on the pain. How do I make the source of the pain go away? And that's what really, really made me angry with my primary care doctor in the end of it, is that, because, of course there was a lawsuit and all this stuff. And I think we really kind of wrapped that up much too quickly, because there was no specific indication that this is going to be a lifelong injury. It wasn't like, I broke my bone and it's never going to be fused back together. But the muscle damage and the tissue damage that I have, I still have every day. Not every day, but like it's still, if I push it too hard. You. Oh, absolutely. Absolutely.
So how did you find, so we're not 100%.
No.
I'm just going to say we're 60%, whatever it is. How did you get from where you were to 60% on your own? What are the things that you had to do?
I'd say I'm like 80%.
80%.
I'm pretty good. I do have days, but we also have to talk about the injury that happened after the car accident.
Yep, we'll talk about that.
Because that compounded things. But let's just say after the car accident, let's isolate that for a minute, right? So car accident happened, and then that was 2010. So by 2016, by 2016 or 2015 actually, I was able to hold a job where I was on my feet all day. And I was really proud of that. So it took a few years to really get that back to where I had like sustained
endurance.
Thank you.
And so you continuously worked at that. You kept pushing yourself to be physical and seek alternative treatments.
Oh, absolutely. Because I came here in 2012?
You started with us. You definitely started with us.
Yeah.
Do you think being a lifelong martial artist, that mindset helped you recover?
Oh, yeah. Oh, I'm going to cry. You're going to make me cry. I hate you so much right now. Because when I got hit, I was so upset and I was so scared. And I said, I just want to be able to do a flying side kick again. Like, that was like that was like always my favorite kick when I was a kid.
Right. When you got hit, you thought that right away?
Oh, well, no.
That's a legit martial artist.
I can't.
Is my husband okay? Flying side kick? Okay, let's figure this out.
I can't talk about what I thought when I first got hit. But yeah, that was like one of the first things I thought was, am I like, how badly damaged am I? Am I permanently damaged? Or what are the things I'm not going to be able to do again? That was probably the scariest thing that I had to go through, was realizing, what am I not going to be able to do again? And so, I'm probably not going to be interested in going surfing just because of the intensity of like getting tossed around by the waves and having something like on your leg, the
wrap.
Yeah, the wrap on your leg. That I feel like presents a little too much risk. I don't know, I'll probably try it, but it's something where, I used to surf a little bit. And I don't.
So you had to change your life a little bit.
Yeah. Oh, for certain.
But the mindset of being a martial artist from a kid, the discipline, the failing and continuing, the martial arts mindset, how did that help you overcome an injury like that, like a traumatic injury?
Well, first of all, it made me think, obviously, I'm not just going to lay down and take this.
Yeah, you're not going to give up.
Yeah, no, absolutely. No.
But do you think if you didn't train the martial arts that you would think that way?
I honestly don't know. I mean, that's always kind of who I've been.
Right.
I mean, I think that, in the previous schools I had trained in before I came here, there was all these like principles of a black belt, right? And one of them was always perseverance and indomitable spirit. I'm sure you know what school that comes from. So that was the big thing that for me, I was like, well, indomitable spirit, perseverance. I'm just going to keep going and keep going and keep going. If I hadn't had that sort of programmed into my brain from, a little kid, I mean, it's really easy when you're in a lot of pain and you're scared and you're not getting the right medical care
you're
to
alone.
move yourself forward fast enough. Sweatpants are comfy. I mean,
yeah, right. Sweatpants are comfy.
Right? Yeah. I mean, it certainly is easy, but I also think that, I mean, unless you're, unless you really have a broken spirit in that situation, you get to a point where you're like, well, it's boring to just sit around and accept that this is my situation.
Yeah, I think the big thing there is to not make that new injury your identity.
Oh, yeah.
If you make it your identity, it sticks.
Mm-hmm.
And then you start getting all the attention. I'll just use you as an example. This didn't happen, but like poor Dana. Dana got hit by a car. Okay, let me bring soup over to Dana, right? Like checking on Dana. But that's hard to lose that identity because you lose all the attention, right? So, but your identity from the martial arts mindset was like, I'm going to overcome this.
Yeah.
If somebody's not giving me what I need, I'm going to find somebody who will.
Right.
Right?
Right.
So let's talk about the brain injury.
Mm-hmm.
So it changed your personality.
Yeah, a little bit.
Tell me about that.
Did my mom tell you that?
I think you told me that.
It did. I mean, it was really difficult because two things happened. Number one, I definitely had PTSD. Mostly from seeing my husband get injured, and I had to go through EMDR to heal that. I mean,
which is
EMDR. It's a treatment modality where basically you kind of retrain the brain. It's that thing where you kind of switch your eyes back and forth from left to right, and you relive the situation, but it retrains your brain so that it doesn't feel so traumatic.
Okay.
Because I was at a point with the PTSD where if my husband left to go get milk, I would be convulsing in sobs until he got home. So I was really...
How long after the accident was this going on?
Years.
Oh, yeah, okay.
Yeah, years. That's why I realized this is not sustainable. I mean, I wasn't like that. I wasn't crying when he left the house for years after, but I was
You get the anxiety.
Oh my God, yeah. Horrible. Super, super, super anxious. So that was really difficult. So that was one thing, was like PTSD definitely affected me a lot. But also because of the concussion, I got worse migraines. I developed a really strong sensitivity to certain noises. Even today, I have to monitor it. It's really difficult. Like if I'm in a restaurant and I hear a bunch of clinking glasses, or not really glasses so much, because I love the sound of breaking glass. It's my favorite sound in the world. But utensils, that specific little ting of utensils, it just sets my brain on fire.
That's why I got plastic cups.
Thank you. You're welcome. It was really strange. And I remember, because at the time, we had gotten injured. I was living at home. I was living with my mom because I couldn't, function on my own. And
I don't think people, I'm going to stop you for a second.
Yeah.
I don't think people realize how a brain injury, like a concussion, changes the person.
Oh, yeah.
Right? It can be extremely serious.
Oh, yeah. Mm-hmm.
But anyway, go ahead.
Yeah, no, it did. And that was what was difficult, is I think that no one around me really understood what was going on with me.
Especially back then.
Oh, yeah. And because I seemed normal like most of the time.
But even research-wise.
Oh, yeah.
Right? Like, that was the time when you were in high school, whatever, like you got a concussion in football, you went right back in.
Oh, yeah. I got concussions in hockey. I got a concussion skiing.
So we just didn't know. We didn't know.
Yeah.
So now you're dealing with an injury and people don't know.
Mm-hmm.
So you probably definitely got that she's making it up, like...
Oh, yeah. Well, and that was, or just that I'm being,
dramatic.
yeah. Or, other words we could use. So, that was the thing. It's like, what's wrong with you? Why are you so mean? Why are you so nasty? And I'm like, I don't know.
Right. And that's not your personality at its core.
No.
You're mostly love and light.
Yeah.
And some blonde highlights.
Yeah, my mom got me a t-shirt. It's just a silly t-shirt that says I'm mostly like peace, love, and whatever, and a little bit of,
Glitter.
yeah.
So then for you, okay, so we start the martial arts here.
Mm-hmm.
Do you remember why you sought me out or why this studio? Is it because of my fashion sense?
No idea.
Okay. Do you think the universe just led you to me?
I literally have no idea how I found you. I think I literally just Googled jujitsu because at my old studio that I was at before I got hit, it was more like Krav Maga and Muay Thai, and like I had a long history in Taekwondo, but I had studied jujitsu when I was in school in New York, and I really missed jujitsu. So that school just didn't have enough jujitsu. I only had jujitsu like once a week. And I said, if I'm going to go back to this, first of all, that school was just a little bit too hard I knew my body had changed. And so I said, let me just see what's out there. And I think I literally just looked it up online. I have no idea. But, of course, I'm going to get all emotional again. And I called you, and Brian answered the phone. And he said, this is Sensei Brian. And I explained to him my situation. I said, hey, I got hit by a car. But I've been a martial arts for a long time. I'd really like to come back to the martial arts. I'm scared about what I can do, given the fact that I have injuries. And he said, well, I have spina bifida. I'm in a wheelchair. So if I can do this, so can you.
Yeah. So Brian was my main student, my top student. He's about 10 years older than me, but he's in a wheelchair since birth. Had arms twice the size of me. Had a grip that was like a vice. Would laugh. His favorite joke was like, I tried to be a stand-up comedian, but I kept falling down. Right. So
that's exactly what he would say.
Yeah. So, but anyways, we answered the phone, and I think having an instructor in a wheelchair, let people have no excuse.
Yeah.
Right.
Mm-hmm.
And so now you're going through training, stuff like that. So you just got your black belt, right? Like a year ago, was it?
Almost 2.
2 years ago.
Yeah.
How did that feel?
Amazing. Obviously, I had worked so hard for it. It was such a long road, and it had taken forever because of how many times I moved, how many times I changed schools, all the different changes that happened in my life.
Was that your first black belt?
Yeah.
Okay.
Getting injured so many times.
Have you ever looked back, like maybe that day you achieved your black belt, right? You work for it. It's not something that we just give to you because I like you. Did you ever look back at the journey that you went through and then actually achieved a black belt? Have you ever thought about that? Like all the ups and downs?
Yeah, I think about it all the time. I have to think about it all the time. Because if you kind of let yourself go, oh yeah, well, I achieved that, and just shrug it off and go, no biggie. You're not giving yourself the credit of how hard you had to work and what you had to push through. And I really did have to overcome a lot to get there. And that was the thing that I liked when I first found the school was, hey, even though you're a little beat up, even though you've got limitations, you can still train here. And we're not going to push you past your limit. We're going to help you be, you've always said this, we're going to help you be the best martial artist that you can be, not someone else's standard. And so that was the other thing is that especially right before I got my belt when I was, starting to train for it, that was a funky time because COVID happened and just some other personal things going on in my life. And I had so many people saying to me, well, why don't you just wait and get your black belt later? And that made me so angry. I said, no, I've worked this hard for it. I'm almost there. If I put this off for another few years or something like that, it doesn't honor all the work I've put into it up to this point.
And the lessons you've learned through that.
Mm-hmm.
Right.
Yeah.
And I think that's a big thing, just through my training and teaching. Listen, everybody is going to have their own potential, right? You do not expect, let's just say, a 50-year-old woman with 4 kids who starts martial arts at 50 and say gets a black belt at 55 to have the same caliber of skill as an 18-year-old wrestling athlete who starts jiu-jitsu and gets his black belt at 22.
Right.
They're both black belts, totally different life, totally different skill sets, whatever. But if that 50-year-old woman put the time in, knew the stuff, was the best that she could be, what if she had one hand? One arm. You can be like, you can't get a black belt because you only got one arm. No, but you're the best that you can be. You've achieved that. You put in the work. You're a black belt period. Right? And what you learn from being a black belt is like all those triumphs and all those challenges that you overcome that you take into life. And if you're a mother, you pass down to your kids, right? You pass down to your other family members. Now let's back up just a little bit. So we're getting better from the concussion. We're getting better from the car accident. What happens to our ankle?
So
do you need more champagne to answer this question?
So much. So I had gotten, to a point after the car accident where, I had pain and my back is never going to be the same. Nothing's ever going to be the same, but I could remember numbers again. And
we're making progress.
Yeah. And I wasn't as, irritable and grouchy and, all these little things that would set off my brain and make me go crazy. Were just, everything was starting to get a little bit better. Right. And I had a job where I was canvassing. So I was walking door to door. Worst job ever. Don't ever do that. Ever. It was a stepping stone.
Yep, of course.
It was a transitional period. I keep rubbing this table because these gloves feel so soft.
Yeah, I put like Vaseline on the table so it'd be easier for you.
It's just like soft. But so I was at a point in my life where obviously this is a major stepping stone job. But I was walking for 5 hours a day, 5 days a week. So I was really proud of myself that I had, built my strength back up and built my endurance back up. And, after doing that, I could go home, ice my leg or, do some massage work, and I would generally be pretty okay. Then I stepped in a ditch.
Not on purpose.
No. And we're not going to go there with the negativity, but this particular company that I was working for wasn't exactly on the up and up in terms of actually giving a hoot about what their workers were doing. So I was out late at night, still working, walking in a dark neighborhood, and I just stepped off a curb and rolled my ankle and rolled my knee or, twisted my knee. And because I had gotten hit by the car, obviously it just really exacerbated all of the pain that I had in the first place, but then created new pain. So I had gone to the, just like urgent care. And this is another thing in terms of medical attention. I told them my knee really hurts. There's something wrong with my knee as well as my ankle. The entire time that I have been struggling with this leg injury, no one has paid any attention to my knee. I've begged people like, hey, pretty sure it's my knee too. There's something wrong with my knee too. I got hit by a car in like the back of my leg. This is also affecting my knee and there's compound injuries there. No, we're just going to fix your ankle. Oh. I don't even have words. So what happened with that is because of the, compounding of those injuries, I went back to physical therapy. And as much as, I think my physical therapist did as much as she could do, there was serious nerve damage there. And that was the thing that really held me back, was the nerve pain. It felt like somebody was taking a lightning rod and sticking it on my leg, and I had shooting electrical pains going from my ankle up to my hip 24 hours a day for 2 years straight.
How'd you deal with that?
Grit.
That's a great answer.
Basically, I still couldn't just stop. And again, that there was some situational problems in terms of the crummy company that I was working for and their insurance policies and all of that. So it took me a very long time to get care, which is ridiculous.
Well, insurance companies don't want to pay out to give you care.
But I also didn't get immediate care. It was like, oh, here's a boot. We'll see you in 2 months. And I'm like, whoa. No. I mean, they just didn't. Yeah. Anyway, eventually they failed because of an insurance claim. So
there you go.
Yeah. So anyway, so that was really frustrating because that was especially when in this whole journey, when the whole, oh, you're faking it. Oh, this can't be real pain came into consideration. And I remember I had one doctor who literally I mean, I'm in this office, like, I'm like literally crying because I'm still in so much pain. I've been in pain for 2 years. I don't know how to get out of pain. And they did a nerve test on my leg, which hurt more than anything I've ever experienced. And I'm sitting there, and he looks at me, he says to me, this is psychological pain. What you really need to do is to just start moving around more. You should start running.
Oh.
And I'm like, I can barely walk comfortably. I'm in so much pain. Like, you've got to be joking. And yeah, and at that point, I was basically saving up all of my energy to, come here like one day a week and kind of just chill and just stand there.
I remember that, yeah.
And use my hands, but really not use my legs at all because I was in so much pain. But I would at least come and learn something, right? So it was like all of the physical energy that I had during that time, I would put into,
constructive.
Yeah, at least.
And how did that help you take your mind off the pain?
I mean, just feeling capable in some way, even though I couldn't, like, kick or run or do all these other things, at least I could do something.
Yeah. And I think I've said this before, but the job of a healthcare professional is give the patient hope.
Mm-hmm.
By telling you that, you're basically not even giving them hope. You're taking everything hope away, right? Because you don't know who to trust. You're probably thinking, can I even trust myself at this point? Because all these medical professionals are giving up on me. So it makes you second guess it. I honestly believe that, healthcare professionals don't actually heal anybody. They give you the hope where a person can start believing they can heal themselves,
mm-hmm.
right? Now, they can give you interventions that make you feel better. But when it comes down to it, when I tell a patient, oh, we got this, it's just muscular. Because it is.
Mm-hmm.
They're like, oh, okay. Next day, they're like, wow, I feel a lot better. Yeah, because I told you what it was. I gave you the hope and I showed you the light.
Mm-hmm.
And then what you think about it and how you act accordingly heals you, right? So I think when a doctor or healthcare professional gives that, like, you're making it up, well, you're just perpetuating everything,
mm-hmm.
right? Now, granted, are there people that make it up? Of course. But that doesn't mean everybody is. Right? And I think that's really important to be an advocate for yourself, for your family,
mm-hmm.
and then, for your loved ones. So what's next for Dana?
Well, I mean, you mean now? Or
yeah, so what are your goals going
next?
forward? What does something happen next?
Well, yeah, I think it's important to talk about that because How did I get here? How did I get from ankle injury to black belt, right?
Tell me.
I'd like to talk about that because that really set me back, right? And then that one doctor, I mean, he could take a hike. So what I just said, this is obviously wrong. And then I just decided, kind of like you said, well, I'm going to have to fix this myself. I'm going to have to figure out how to make this better. And obviously with nerve damage and everything that had gone on, it does take time.
Sure.
So I realized I also kind of had to be patient, but I mean, I genuinely sought out everything I could possibly think of. So, health insurance didn't cover any of this stuff, but I went through acupuncture, I went through Reiki, and even just mental exercises that you do yourself, yoga, meditation, all these things. I had to go through all of these processes and, healing modalities that were basically just me focusing on what I felt my body needed and
listening to your body.
Yeah, absolutely. And I have to say that what really ended up helping the most in the end, I think, was the acupuncture. That was really life-changing. And finally, I did have a doctor who finally got me a medical marijuana card. So I am not big into smoking or anything, but there was a cream, and that really helped to just reduce pain enough to a point where I could be more physically active and, get a massage without being in excruciating pain. Because even massage and stuff like that would really hurt. So I have to say that after so much time of saying I don't need any drugs,
right.
I said, all right, finally, I'm at least going to try this because it's, it's a natural remedy. And it did really help. I used the creams that really helped. I used this crazy Chinese herb salve. I put that thing on a lot. That came from my acupuncturist. And so it was just I had to do so many different things to start to feel better. And then eventually it started working. I mean, there are days when if I stress my leg out too much, I will get nerve pain, which is no fun. My ankle still swells, but
But it's not enough to stop you.
No, right. It's definitely not enough to stop me. And that's the thing, it wasn't enough to stop me. And I said, all right, I'm at a point where finally I'm good enough where I can pursue my black belt. I can take that calisthenics test. I can handle that.
Yeah, because you got to do the exercise portion first.
Oh my God.
Then 2 more parts.
Yeah.
And if you didn't pass the exercise part, you don't get to go to the next 2. Right. So 2 more questions. So what do you want people to know about brain injuries and like what the person's going through, right? Because unless you have a brain injury, you're not going to know. Even as a therapist, for me, when we had, a patient's like, it's hard to tell. Like, I don't really know what's going on. I have to take your word for it. Like, I don't, and symptoms that you wouldn't expect to see, you see, but anyway, so what would you just want to tell someone, what's it like? Like, what should, you have someone who has a brain injury, a friend.
Yeah.
How do you help them? Like, what should you be thinking, right? Because I say that because, like, a lot of times, you might be short-tempered. And now I'm your friend, and I'm like, why is Dana acting like this? I don't want to be Dana's friend anymore.
Right.
Not understanding the mechanism of what's really happening. So what do you want to tell people about someone who has a brain injury like that?
Oh, I don't even know if I'm in a position to give anybody advice. Because...
No, not advice, but just like you went through it.
Yeah.
So what would you like other people to know that you don't mean to be angry? Like, you're not agitated at them kind of thing.
I would say trust the people around you, because I also kind of, I feel like I wish I had listened to Mom. You'll love this. I wish I'd listened to my mom a little bit more, because she kept saying, we need to get you a different doctor for your head. And I would say, oh, I'm fine. I'm totally not fine at all. But so I would say, listen to the people around you if they're trying to get you different modes of help. And also be patient with yourself, and don't be embarrassed to say, hey, listen, I had a head injury.
Sure.
I don't know why I'm acting like this.
I think that's important.
And it's okay to kind of like look into yourself and identify. And if you are exhibiting behaviors that feel strange to you, or even scary or out of control, to just know in your heart, this doesn't feel like me. This isn't me. And to trust that and go, okay, it's okay. I know who I am in my heart. I know that this isn't me. That's my brain. And to kind of be able to separate those two, because it can take a toll on you psychologically. You think you're going nuts. You're like, why am I acting like this? Why do I feel this way? If that's not kind of true to who you are in your heart.
Yeah, I think that anytime you have any kind of injury, the thing you need to remember is that this is not forever. This is just for now. Right? Having that understanding that this is just now, this isn't going to be my life forever. I will overcome that. I think that really helps people. Oh, okay. Like, there is light at the end of the tunnel. So there's someone watching this video right now, and they're like, wow, Dana and Marc are really dressed really nicely.
They look great.
They can't see that I'm wearing shorts. So they're just down on their luck, right? Maybe they're injured. Maybe they're not. They're not motivated. They're overweight, depressed. What is your advice to them?
Find something that makes you feel happy. No matter what it is. If you're having the worst day, you feel so down, you feel so broken, you feel totally despondent and defeated. But there's one good thing that happened that day. There has to be something. Even if you lay in bed all day and you eat ice cream and you feel like crap and you do nothing but watch movies, that's okay.
If that's what's making you happy.
Right. If that's what you need to do to soothe your pain, that's okay. But don't give in to that negativity if you're feeling it. I think it's okay to go through those emotions, but don't let them take over. And know that there's always one tiny little good thing that you can focus on, and focus on that good thing. Just, one thing a day, right? And then the next day, maybe you'll notice 2 good things. And then the next day, maybe you'll notice 3 good things. But you have to hold on to some, I don't necessarily want to say positivity, because I think that it's difficult to just be positive when you're going through something so difficult, but seek out something that gives you a little glimmer of joy. I don't think you can fake positivity, but I think that you can find joy even when you're suffering.
So I know we're both Abraham Hicks fans.
Yes.
And one of the sayings they have, you could have 10 things going on in your life, right? And what humans mostly do is 9 of them could be amazing, but one thing you consider not amazing. And as humans, we focus on that one thing.
And you let it trip you out.
And it trips you out and it ruins everything. However, they're like, it could be reverse. You could have 9 things that are going horribly, and you have one thing that is going really well. If you were to focus on that, then you will attract all the good things, right? So it's kind of exactly what you said. And just from the bottom of my heart, knowing the struggles that you went through, how long have we been together?
Oh gosh. Well, it's been at least 10 years.
I didn't have any gray hair then, did I?
No.
I didn't. So over the 10 years, I've watched you grow. I've watched you overcome the challenges that you've had. You're definitely one of the most genuine people that I know, which is why when you didn't want to dress up for this, I was like, Dana, I don't even know what's going on right now.
And thank you for seeing that spark in me and bringing it out.
Yeah.
Thank you for recognizing me and going, wait a minute, that's, you know yourself. That's not you.
Yeah, I thought we'd be in like Ninja Turtle suits.
When should it? That would have been cool.
I agree. But anyway, being sincere, like I'm proud of you. You're an inspiration to a lot of people. And I think this helps people understand your story more. Right? And everyone in the school is proud of you, and you're a beautiful person, and we only wish you the best. And cheers.
Thank you. Cheers. You're the best too.
Thank you.
Hey guys, Dr. Mark here. Now I know a lot of you want to know how we get all these amazing results with our clients, and it comes down to 3 things. The first is fun fitness classes that burn a lot of calories. 2 is giving you an accountability coach to make sure you stay on track and get the best results. And 3 is the nutrition. Included in the nutrition is our food supplement. So we pair with Prestige Labs because I feel they're the best, they have integrity, and they get great results. These are actually the supplements that I take as well. Here's the awesome part. By clicking the link below, you can save 40% off the retail price. So you need that link to actually save 40%. If you just go to the normal site without my link, you're paying full price. Okay? So these are the supplements my clients use. If you are interested, definitely click the link below and it'll tell you all about them.